I'm Valerie Oakley. I'm a pharmacist who studies the art of compounding. When a physician asks me to create a custom compounded medication, there are a lot of steps that are involved. The first thing I always like to do is get a feel for what symptoms the physician is wanting to address, what the medication is that they're actually wanting the patient to have, and the strengths. We need to go through and figure out the dosage form that either the patient needs out of necessity, if they can't swallow a capsule, then we can give them a sublingual. If they have allergies, then we can certainly take certain inactive ingredients out of it. But you go through these questions when you're talking to a physician as to what the formulation is for, what's the specific need of the patient, are there any extenuating circumstances. Once you've gotten the kind of gist of what formula you want to use and the concentrations, then it starts the whole researching into putting it together. And putting it together involves a process of calculations and research and other formulas that have been used, what's worked in the past, what hasn't worked in the past. Sometimes that requires me to extend out to other colleagues. I love the research involved. I mean, you learn so much with every new innovative formula that comes to you, and I think it's a great part of the compounding process, but they do take some time, and so depending on what it is and what's our objective, then it will depend on the time it takes, and that can be anywhere from an hour to 2 days. But 3 days, you just never, it depends on what the formula is.